Hi, everyone. It's Alex Savage from KTVU, Fox 2 News in the San Francisco Bay Area. And we are facing a dire situation right now here in California. Cases of coronavirus are exploding. And today, new restrictions, a stay-at-home order now in effect for much of the state. Joining us now to talk more about it, Dr. VANILA SINGH, clinical professor at Stanford School of Medicine and the former chief medical officer with the Department of Health and Human Services. Dr. SINGH, good to have you.
Hey, great to be on again. Thank you, Alex.
All right, always appreciate your perspective here. I mean, we're kind of in some ways with the way the cases are trending in California and these new restrictions. Essentially, a lot of indoor, outdoor businesses, non-essential businesses are not allowed to open, and capacity limited at other businesses here. We're sort of back to kind of where we were at the beginning of the pandemic. What do you think about these new restrictions being put in place? Is this the right move?
Well, so first of all, it is tough to hear about the surge in numbers. Of course, that creates a lot of concern amongst people. And of course, the effect of stay-at-home orders on top of the curfew, which had gone into effect ending at 10, has really made people very anxious and I think also very frustrated, understandably so. We know and expected the winter, colder months to have a surge. That's consistent with other cold viruses and the influenza virus, for example. So we expect there's going to be a surge in hospitalizations and ICU from those diseases and others due to cold weather months. And then add on COVID, and you find yourself in seeing these high surges in hospitalizations, as well as in ICU beds, and that capacity that does have people concerned. Is it the right thing? I think the challenge in all of this is the mixed messages that people are seeing and perhaps some of the inconsistencies. For example, outdoor dining is now being restricted after months of having a good success in that realm, but right. Indoor retail stores are still open, and thankful for that, actually. But that really makes a portion of our population feel very disaffected by this and perhaps even targeted. So I think that's been challenging. And then also some of our leaders have been at some of those restaurants defying the very orders that they have put in play. And that makes people also feel discouraged. So really, I think what the doctor's ordering now is to take this seriously, but to have a consistent, logical message that makes people feel like when they do sacrifice, that those sacrifices are actually going to efforts to help the COVID epidemic rather than be arbitrary in nature.
Yeah, I was going to say, I mean, we're in a much different place with this disease than we were back in March. And it does seem like we could have a more nuanced approach in terms of stay-at-home restrictions here. And a lot of people do look at it and say, well, outdoor dining seems to be a lower risk activity, obviously poses less risk than indoor dining. Playgrounds, seems like we could make those work in some way as well, right?
Yeah, absolutely. You brought up a great point there about the nuanced need. I agree with that because, again, we're much more knowledgeable about the coronavirus, which was completely novel back in February, March, April, May, when we were seeing these numbers. And also, we know that other areas are safer. We have schools that have reopened, thankfully, and will stay reopened. But as you mentioned, the playgrounds are now off limits. That's what is confusing to people. And I think that's what leads to the frustration that we're seeing in people across the state. And these are people who are, I think many of them are people who are on board with trying to fight this as a community, as individuals, and as a society. But on the other hand, it has to make logical sense. And, so this is something that hurts the families, hurts our abilities to get out of the house. We know that that has its own medical implications with mental health and also just the fresh outdoors rather than being cooped inside. So these are things that we have to look at. We cannot do it on a blanket statement. I've heard that state swim schools are also made a deal to stay open, which again, I think that's great, but it does lead frustration to other folks who are not able to get their kids into other activities like sports, which does play a big role in helping kids in their time of formative development, physically and mentally. So we need to be nuanced and balanced. I agree with you 100%.
All right. So, I mean, I understand, beg your pardon. I understand the frustration where, you're a restaurant owner and you have now been told to shut down your outdoor operations, and you've obviously, set up one of these outdoor situations. And then across the street, you have a store that where people are allowed to go inside and shop at one of these stores, albeit it's with limited capacity. But are those two scenarios, the person inside the store, it seems like that's a different scenario. That person is keeping their mask on the entire time. You can make the argument that the reason that dining just in general poses an inherent risk is because it involves taking off your mask to eat or drink.
Yeah, so absolutely, you can go by both two different factors here. One is indoor versus outdoor. So the outdoor, the dining has that advantage.
Mhm.
And it's not an either or, just showing you compare. But of course, indoor retail, people have to have their masks on. What is more protective at this given time in the season with this given virus, which may have some genetic drift? You know, it's going to be interesting to see the factors at play. We're not certain. And when you look at other states around the nation, some states still have indoor dining in the colder months, which are colder than even California. So it is something that I think when people are feeling the impact on their livelihood, they have a sense of this. I can also say that our hospitalizations have surged about 72% across the state, but 14% of those account for COVID, meaning the other remaining, 50-60% are due to non-COVID related hospitalizations. Again, it's this time of year that does pose a test on capacity. And I do understand that there are going to be backup plans, which I hope we are absolutely working on. And I mentioned before that we need to work on things like another naval hospital ship in California that provides additional capacity as needed, maybe two smaller ones, for example, if that's even feasible, as well as alerting warm teams that I understand that the state is working on, teams that can be up and standing in 24 to 48 hours to help with ICUs that may get overflowed, as, and the California Public Health Corps, which has, it's about 900 people strong. I also will point to other measures like the contract tracing that is being offered right now by app, by both Google and Apple. It's not mandatory, which I think is a good thing, but it is something that can allow people an alert if in fact they're able to find if somebody had tested positive for COVID and they were within 6 feet of that person for 15 minutes. I like these kinds of things that allow for people who really are concerned, maybe they're elderly, they're vulnerable, and they want to be safer. Those are, I think, good means to help us identify those folks who need to get tested or just let their doctor know.
Yeah. So, I mean, just to, sort of drill down on the point about the hospital situation, I mean, it's all tied, these new restrictions, they're all tied. It's all tied to the available ICU capacity here. And in some spots, it's down to just 10% in the Southern California region, the San Joaquin Valley, it's down to just 6.3%. Explain one more time for everyone why that is being used as the threshold here, the trigger for new restrictions. Why are numbers like that so concerning to state health officials?
Absolutely. If we all think back to our original lockdown, shutdown measures that took effect in various places around the nation back in the spring, late spring, it was to flatten the curve. And flatten the curve was all about ensuring that our medical system was not going to get overburdened, that if in fact the virus was spreading rapidly and our beds in the hospitals and the ICUs were being overrun, we were concerned about a moment where we may be overwhelmed and not able to take care of people in the manner in which could help people get through those tough times. Now, this is really just another version of that. It is flattening that curve that's gone up in terms of ICU beds being utilized. And so logically that makes sense, especially because at this time of year, we know other seasonally viruses and infections are on the rise and are also competing with the COVID for people who are getting sick. So what I think is important is that we take action, but the action has to be commensurate with what we believe will help flatten that curve. And in many ways, we also need to ensure that the medical therapeutics that we know from so many different studies around the nation and around the world, we are looking at those to help the folks who come into the hospital or before they ever even get there, to prevent hospitalization or to limit the duration of hospitalization. So the bed issue is also being addressed in a very scientific, direct manner, in addition to asking people for their sacrifices of economic shutdowns and limitations, which we know have a role to play, but it really has to be really all hands on deck to ensure that we're have the ability to take care of people across the board, young and old, sick or not so sick.
Do you think that the shutdowns happening here in California are going to be as effective as they were initially back in March to bend that curve in terms of cases? Or are
No,
we
I think
in a
that,
different place right now and people are worn out and it's just it's going to go in one ear and out the other for a lot of folks?
I mean, the good news is this country, I mean, we're made up of really good-hearted people, and I think people want to help. And I know everyone is frustrated, and there is a sense, I mean, a lot of folks feel like it does start to encroach on civil liberties, economic livelihood, mental health issues. But on the other hand, I know people want to get through this. It is interesting to think back about how much did our behavior actually flatten the curve, but also was there seasonal approach. Also, remember, it was the warmer mindset that started to play a role. We also got better in terms of how to medically treat some of these people. We were intubating too many of those folks in New York, and now the approach for ICU and hospital care is different. And so there's a lot of different factors that are at play. We also started to have the travel restrictions, etc. Those things were from abroad and probably really helped stave off further increases back then. So the situation's different. I do hope that our capacity to continue to use the masks and wash our hands and stay socially distant and also limit our household interactions continues to play. But I do also feel very strongly that folks who need the economic livelihood get the support that they need from the agencies.
Absolutely. I mean, it's got to be, it's got to be the approach has to be twofold. If you're going to tell a business that they can't open, then on the other hand, you got to help them out in some way to make them whole. There's just, I mean, I don't know who would disagree with that. But you just have to figure out a way to do that. If you're saying this is the safest thing to do for this restaurant to not be open at all, you have to compensate them.
That's right. And I do want to remind everybody, I know it's hard to hear all this other stuff, but the positive is that we are on the heels of those companies that are asking for the emergency use authorization. And again, the manufacturing dissemination of the vaccines and the tier 1A people who are poised to get them, that has all been roadmapped. And hopefully we'll be able to get that. So that starts to help change the surge that we see so that key people, essential workers, healthcare workers, nursing home residents, etc., get it. So we start to address what we're really concerned about, which is protecting the vulnerable, protecting those who are at higher risk of getting it. And then we move to the tiers and the broader public use. I think that's really important to keep in mind, because anytime we have this discussion, we've got to have all the efforts that are going on so that people don't lose hope and stay part of this.
All right, final word here, Dr. Singh, on coming into the heart of the holiday season, and I know you've heard we have these new restrictions here in California that are in place, and obviously the situation is very serious with the cases, and we've heard the warnings from public health officials to really everybody has to just be extra cautious here over the next few weeks. What is your message to folks here around the holidays, and everyone's going to be tempted to maybe go spend some time with family or travel or do stuff like that? What's your message?
My message is to take heed, be informed, use your common sense and individual understanding. If you're at all confused, reach out to your doctor about what you should do. If you have a family member who's more vulnerable, I would suggest they should be protected. Maybe, unfortunately, they don't join the household in their celebrations or remain separate, which is so hard to say because the holidays represent so much. I would also suggest people to call up loved ones and friends and watch out for people who are at risk for social isolation, for those who are at risk for increased depression and suicide at this holiday season. I'm very concerned about people out there who are alone. And I would say that if you want to feel empowered and feel good about yourself this holiday season, make it a point to reach out to friends and family who may need your help. And you can certainly make them feel like they're part of things by such outreach. And remember to be calm and carry forward.
Good. solid message. And yeah, it's going to be a tough holiday season. And just no other way to slice it. I mean, it's going to be hard, no matter how it plays out. But there you go. We can be with each other even if we are not with each other. There's ways to make it happen. Dr. Singh, thank you. We'll be talking before the heart of the holiday season, but I appreciate it. That's a very important message to get out there to everyone. We'll leave it right there. Always appreciate your time. Dr. VANILA Singh, clinical professor at Stanford School of Medicine and former chief medical officer with the Department of Health and Human Services. Always appreciate you coming on.
Thank you. Thanks so much, Alex.
Sure.